the deadline for the ACA's special enrollment period was supposed to be May 15th, but that got moved to August 15th. So you are in luck. Before you go filing your taxes, though, you need to know that the marketplace premiums have been waived for the 2020 tax return time. We have experts to help you navigate all things ACA and Medicare. Catherine Sevier is with AARP of North Carolina. Morgan Campbell is with Alliance Insurance Services, and Laura Packard is with Get America Covered. They are all here to answer your questions. And so how do you get your question answered? You text your question. The number is 336-379-5775. We ask you not to call that number, but to text that number. Okay, Laura, let's start with you because the deadline to sign up for the marketplace was supposed to be this week. It's now been extended. And so that gives people a little bit more time to figure out what's going on.
Absolutely. You have until August 15th to sign up. However, why wait? Everybody needs healthcare, so go to healthcare.gov now to find out what your options are.
All right, so often people are saying, okay, I see that the deadline is not until August. What about if I pick something and then I decide, ooh, that's not the right thing that I wanted to pick? Can I change it?
Yes.
So what is the process with that so that people can have a better idea?
Morgan, you want to cover that?
Sure. So all you do is log into your healthcare.gov account or call your agent or broker who actually helped assist you with that application initially. Go through, click report a life change, baby step your way through that application. And then when you get to the end, you're going to have your new tax credit that has been put in place, and you'll see all the plans that you're able to select from.
Okay, and then there's something, Laura, that you guys are watching when it comes to the Supreme Court and the Affordable Care Act.
Yes, there is a lawsuit that threatens the entire law itself that has been working its way through the courts for the past couple years, and the Supreme Court is due to rule on that anytime from next week through the end of June. So pay attention. Don't be too concerned yet, but do pay attention to what the Supreme Court is doing.
Okay. All right. So let's also talk about Medicare and timing of Medicare. So Catherine, let's talk about that first and foremost. We're talking about Medicare timing, when you have to sign up for Medicare.
So when you are about to turn 65, 3 months before or 3 months after, so there's a 7-month window there where you have to sign up for your Medicare benefit.
And that starts 3 months before your 65th birthday. It goes to 3 months afterwards. That is the 7-month enrollment period. And if you do not sign up at that time, Catherine, what happens?
You get a penalty. So we don't want you to do that. We want you to sign up. If you're still working, we want you to talk to your human resources department about whether or not you have a credible Part B plan, and then you can decide whether you want to go ahead and sign up for Part B or continue with your health care insurance with your employer. Either way, you've got to sign up during that 7-month period or you will pay a penalty for the rest of your life, and that is not something that we wish on anyone.
Right. Okay. So you need to sign up for Medicare that year of that 65 year. Otherwise, you're going to pay a penalty for the rest of the time that you use Medicare for the rest of your life. Now, a lot of times people get stuck on what do those different parts mean. So let's look at the different parts of Medicare and what they cover and why, so that you'll know what's going on. So Part A covers that inpatient hospital stay. Part B?
Part B covers your doctors and your outpatient care.
Part D covers prescriptions.
Correct.
And then there's something called Medigap.
Correct. And Medigap is the additional policy that you take to help cover the deductible and the part that Medicare does not pay for. There's also a Medicare, what we would call Part C, which is Medicare Advantage. And Medicare Advantage is a roll-up, if you will, of Part A, Part B, and Part D, so that you're part of a network and they take care of everything for you as part of Medicare Advantage.
All right, and Morgan, let's talk about Medicare Part B, because there's a lot of back and forth about what happens with B.
Right. So when you actually turn 65, you're automatically going to be enrolled in Part A if you've worked your 40 quarters and you're eligible for Part A. At that point, if you have coverage through your employer and your HR department has confirmed that it is considered credible coverage, then you do not have to sign up for Part B. When you go to retire, say at age 67, you simply let Social Security know. You can do that through your SSA.gov account. They will automatically trigger paperwork that will be mailed to your employer to confirm that you have had credible coverage through those 2 years that you chose to work and keep that employer coverage. And then they'll give you your Part B effective date. It'll be different from your Part A effective date when you turn 65, but then they will issue your Part B, excuse me.
Okay, but you have to have credible coverage. So you need to talk to your HR people to make sure you have credible coverage. All right, we're going to be right back with more of your questions in just a moment. All right, we are here with Morgan Campbell, Laura Packard, and Catherine CVA. They are answering your questions about health care enrollment and Medicare. Laura, this person's asking, can I qualify for marketplace insurance if I have money in my savings account?
Yes, you can. I think maybe they're asking about income levels, which would determine whether they can get an ACA plan and the amount of credits that they would get. But if you have money in the bank, that has no effect on whether you can get insurance through the Affordable Care Act.
Okay. This next question is, my husband will be 65 in January. That's when he needs to sign up for Medicare. And I will be 64 in 2022. What do we need to do with our healthcare.gov? Am I the only one signing up, or are we both signing up?
He is going to be the only one signing up. She's simply going to log into her healthcare.gov account. She's going to click report a life change, and she's going to remove her husband off of the application. She's still going to have him listed as income and as a member of the household to make sure that they do not get into a tax issue. Very, very important there.
Okay, so that may be one of those things where you want to talk to one of those health insurers like Morgan, who they don't take any money from you. They get paid from the insurance companies, so they might be able to help you kind of figure out what's going on with that. Catherine, this person is asking, if you already had Medicare disability and the Advantage plan, do you have to sign up again at the age of 65?
No, you do not.
Okay. So this person says, where do you go if you need to sit down and talk with someone about signing up for Medicare? I'm sure Catherine and Morgan both have thoughts on that.
Well, there's a number of different ways. Morgan is certainly, and an insurance agent are certainly available to do that. If you need some information and you want to go on the web, the SHIP program from the North Carolina Department of Health is a great program. It's SH2I's IIP. That's a great website to look at. And then AARP.org Medicare has a lot of information too.
All right, Morgan, this person says, I'm 74 on Medicare, supplemental F. I've got diabetes. Can I change to G because it costs less?
You absolutely can change to G. Plan F has been retired. That's kind of like a gym. If you have it, I would be hesitant to let it go unless it was just strictly based off of financial reasons.
Okay. So this person's saying, will my 401k retirement plan and savings account keep me from qualifying for Medicaid?
Yes.
Likely.
So, but not with Medicare. That's a totally different thing. Medicaid is something totally different from Medicare. Okay. This person says, my spouse will turn 65 this December. She is not employed, and she's fully covered under my employer's health care coverage. Is it Part A or Part B she signs up for, and is my employer's coverage considered to be primary?
Well, she definitely has to sign up, and she has to sign up for Part A. Whether or not she signs up for Part B is something that you need to look at with your HR department, whether she continues to be eligible through their employment, their insurance, and whether or not it makes sense for her considering what the benefits are.
All right, this person says, what happens if you're on disability and you're turning 65 in 3 months?
Nothing. unless you're have not ever had any Medicare. If you're disabled and getting your funds from somewhere else, you need to make sure you still sign up for Medicare.
Okay. So Morgan, this person says my retirement age is 66 and a half. Do I still need to sign up 3 months before my 65th birthday?
Yes.
Yes, you do. It's that 7-month window, right?
Yes.
Okay. And then this person says when you turn 50, can you qualify for Medicaid or any kind of assistance while working? And I don't think anybody here that's in their wheelhouse, right? Because we're talking about ACA and Marketplace. Laura, did you have a thought?
Oh, sure. Just Medicaid is based on income levels, and especially in North Carolina that didn't expand Medicaid, it's not very available. You need to have specific conditions and make very low amounts of money, and many people are just not eligible at all. So you would have to look into that, but probably you're not going to be eligible.
Okay.
And the 50 age doesn't really make a difference in that. It's really income based.
Income based, not age based. This person says, I'm already enrolled in healthcare.gov. Can I enroll again or change for a lower premium?
Yes. Yes, you can.
Yes, and if you need help figuring out what's going on, an insurance agent will be able to kind of go through some of those things for you and help you try to, unweave all of that. Thank you for your time and your expertise. We appreciate it. If you missed anything, we want you to be able to go to the Two Wants to Know section.